Welcome to IABS IAS Academy. Today we are going to discuss about PIB news analysis on 5th August. Three important news are there: Hydrometeorological Hazards Risk Reduction webinar and about Sendai framework, Garib Kalyan Rojagar Abhiyan, and paper strip kit for fluoride reduction in drinking water. We'll discuss one by one. First one: Hydrometeorological Hazards Risk Reduction. National Institute of Disaster Management (NIDM), Ministry of Home Affairs, in collaboration with Indian Meteorological Department (IMD), organized a webinar series on hydrometeorological hazards risk reduction. The webinar series includes 4 webinars focusing on issues apropos of thunderstorms and lightning, cloudbursts and floods, cyclones and storm surges, and climate change and extreme weather events. Aspirants, please look into these 4 videos. All are wonderful videos, nearly of 3 hours of experts discussion about these 4 topics. Webinar links will be there in our web page itself. Please look into these seminars. The webinar series exhorted and enhancing human capacity in terms of better understanding of hydrometeorological hazards, risk, and effective collaborative actions by implementing Prime Minister's 10-point agenda and Sendai framework for disaster risk management for reducing the risk and enhancing the resilience of affected communities and surroundings. All the 4 webinar talks are available in YouTube links, so please look into those videos. The key takeaways from the webinar series consist of the fact that at present occurrences of hydrometeorological events are quite predictable in terms of time and space through the technological capacity of nodal agencies. IMD and NIDM will further enhance the forecasting abilities that will help to accompany the occurrence of hydrometeorological events in advance with more precision and will aid the relevant stakeholders and communities to take the appropriate prevention and mitigation measures. Sendai framework. Since it is mentioned Sendai framework here, we'll discuss more about Sendai framework for disaster risk management. Disaster risk management aims to reduce socio-economic vulnerabilities to disaster and will as dealing with the environmental and other hazards that trigger them. Less than 1% of total relief aid goes to disaster risk reduction, despite estimates that every dollar spent on preparedness saves $7 in response. The Sendai Framework. The third UN World Conference on Disaster Risk Reduction was held in Sendai, Japan from 14th to 18th March 2015. At that time, the 10-year-old Hyaga framework came to an end and was replaced by the Sendai framework. This is for 15 years, 2015 to 2030. The Sendai framework is a which recognizes that the state has the primary role to reduce disaster risk, but that responsibility should be shared with other stakeholders, including local government and private sector. Sendai frameworks aim the substantial reduction of disaster risk and losses in lives, livelihoods, and health, and in the economic, physical, social, cultural, and environmental assets of persons, business, communities, and countries. The 4 important priorities of Sendai framework are understanding disaster risk, strengthening disaster risk governance to manage disaster risk, investing in disaster risk reduction for resilience, and fourth one, enhancing disaster preparedness for effective response and to build back better in recovery, rehabilitation, and reconstruction. The 7 global targets of Sendai framework are: substantially reduce global disaster mortality by 2030, substantially reduce the number of affected people globally by 2030, reduce direct disaster economic loss in relation to global gross domestic product by 2030, substantially reduce disaster damage to critically infrastructure and disruption of basic services, among them health and educational facilities, including through developing their resilience by 2030, substantially increase the number of countries with the national and local disaster risk reduction strategies by 2020, substantially enhance international cooperation to developing countries through adequate and sustainable support to complement their national actions for implementation of the framework by 2030, substantially increase the availability of and access to multi-hazard early warning systems and disaster risk information and assessment to the people by 2030. Third important news is about Garib Kalyan Rozgar Abhiyan. In news, 17 crore man-days employment provided and rupees 13,240 crore paid to migrant laborers under Garib Kalyan Rozgar Abhiyan in 6 weeks. GKRA providing livelihood opportunities to migrant laborers of 116 districts in 6 states. Prime Minister Modi launched the Garib Kalyan Rozgar Abhiyan on 20th June to empower and provide livelihood opportunities to returning migrants, workers, and rural citizens. Focused campaign of 125 days across 116 districts in 6 states to work in mission mode. Public work worth 50,000 crores to be carried out under the scheme. Focused implementation of 25 different types of works to provide employment and create durable infrastructure. The program will also prepare for expansion and development of livelihoods over a long term. These 25 projects are under like rural housing for the poor plantation, provision for drinking water through Jal Jeevan Mission, Panchayat Bhavans, community toilets, rural mandis, rural roads, other infrastructures like cattle sheds and Anganwadi Bhavans. And third important news is in science and technology. Equipment free, a simple paper strip based NAC dye fluoride ion detection and quantification kit in drinking water to evade fluorosis based disorders. Fluorosis is a crippling disease resulting from deposition of fluorides in the hard and soft tissues of body due to excess intake of fluoride through drinking water, food particles, industries, pollutants over a long period. It results in dental fluorosis, skeletal fluorosis, and non-skeletal fluorosis. Easy detection of fluorides in water can help preventing the public health disorders. Scientists from INST and Autonomous Institute of DST, Government of India have developed an equipment-free fluoride ion detection and quantification in drinking water with the NAC dye. It can be operated by non-experts for households use to evade fluorosis-based disorders. The technology developed by Dr. Jayamurugan Govindasamy and his team involves a push-pull chromophore based on 2,3 di-substituted 1144 tetracyno and 13 butadienes that change color upon exposure to fluoride ion. The identified chromophore is the result of a systematic study seeded by the Early Career Research Award (ECR) and further supported by the Ramanujam Fellowship Grant of DST received by Dr. Govindasamy. Thanks for watching IABS IAS Academy's YouTube channel. Please subscribe the channel for our daily PIB, AR and Hindu news analysis. Thank you.